People often speculate, what is the cause of mental illness? Well, there's no one thing. Bad experiences growing up leave you with emotional scars, which then make it easier to tip over into mental illness if you have the experience of stress or other things going on in your life later. But bad experiences in childhood alone do not guarantee that you'll have a mental illness. In some cases, drug abuse or alcohol abuse, particularly in teenage years, the brain is still developing, and it actually doesn't stop really developing until the early 20s. And the most vulnerable time for the brain is not just when the baby is a baby, but actually is in your teenage years. And that's also a time when there is a tendency to experiment with alcohol and drugs and other things like that. So that can be a trigger for someone who may have already some vulnerability because of a family history of mental illness or because of bad experiences growing up. The straw that broke the camel's back, or the thing that tipped you over the edge, could be substance abuse. And even when you're older, your brain may be well formed, and you may be 30 years old, and your brain is not, still developing. But substance abuse at that time can still be a trigger for sparking a problem where there might have been some vulnerability to those problems because of your own particular genetics or your family background. So it's important to realize that there's no one contributor to mental illness, and maybe that also explains why there's so many different treatments, because so many different factors come into play to causing problems that we can use many different approaches to fix the problems.